Tom, as we know, kids are going back to school and everybody needs to be really safe. And I have to ask you, do you feel some people have gotten a little lackadaisy since we haven't been in school about washing our hands and being safe as we go back?
Well, I would say that that is the case. I go to the grocery store, I go to Home Depot and such, and oftentimes I see that people are being lackadaisical. But I would say overall that most people are adhering to mask wearing, social distancing, and from what I can see, walking into the stores and such, people are using hand sanitizers and being fairly conscientious about it. So one of the interesting parts is that in Arizona, at least, that we are seeing that our case rates are going down, our hospitalizations are going down, things are improving, and so it appears that mask wearing and social distancing and using good hand hygiene seems to be making a difference and driving down those benchmarks.
Yeah. Okay. Getting ready to go back to school. What are some tips that you can give us about making sure that we are continuing our, cleanliness, I could say?
Yeah. So I would say the biggest thing for parents to do is just to monitor their children when they send them back. You certainly don't want to send your child to school sick, or even you suspect that they're sick. So that would be looking for the typical signs and symptoms that we're seeing with COVID. And that would be a headache, fever and chills, diarrhea, maybe some nausea and vomiting. One of the big ones that seems like it's particular for COVID is a lack of taste and smell, or an alteration of those sensations. You also look at, of course, a fever. And if your child displays any of these things, certainly don't send them to school that day.
Yeah, and I think what's really great is that they're doing school online, so if they don't make it into school, they still can do the classes online, which is very important. Social distancing, I know they say it's kind of hard with kids, but it's possible to do, right?
Oh, I believe so. I think kids are very resilient, and I think that as parents, if we model that behavior, that when we're out with our children and we wear a mask, we use good hand hygiene, and we socially distance, our children will more likely be able to model us, and the transition to school won't be as difficult if we take that time to be, good citizens.
Yeah. All right. Let's break a myth right here that I've been hearing from a lot of people, and that when it comes to urgent care, is that, you know what, you guys are saving everything for COVID-19 cases, and people aren't coming when they need to come to the urgent care. So you're saying, no, come. We're here to take care of all the needs, right?
That's correct. Yeah. I would say that patients are indeed avoiding emergency departments and avoiding urgent cares because of worries about becoming infected if they're not already infected. I would say at FastMed, we go to extraordinary lengths to make sure that a person who comes into our clinic is not going to get COVID while they're there. We have them socially distanced in the waiting room. If they have to wait in the waiting room, typically we take them right back to a room. Each one of the rooms is cleaned in between each one of the patients, and then they are discharged directly from the room back out the door, as opposed to going back. And we have a waiting room, but we're not really using it for waiting anymore.
Yeah.
And so we do encourage people to come in if they are feeling ill, and not just for COVID, but for any other one of the ailments that they may be having. And one of the big things that we're striving to do is to try to decrease those loads on the emergency department. So certainly, FastMed, we can see a patient a lot quicker than an emergency department is. So if you're worried about the amount of time that you would dwell with other people who are ill, that would be a little bit less of a concern in one of our clinics as opposed to an emergency department where you can have 4, 5, 6 hour wait. Our waits are going to be considerably less.
Oh, I like it. All right. Where can people find out more information?
They can go to our website. That's fastmed.com. And also, if you have any other specific questions about school openings, I would suggest go ahead and looking at your particular school district's website. Also, if you want to look at the Maricopa Department of Public Health, they have some very good tips on how to keep your children safe. In addition to the Arizona Department of Health also has those, and they're in contact with the governor's office, and they're putting together plans to safely open up schools.
Perfect. Tom, thanks for joining us very much this morning. Thank you for joining us.
Thank you. Have a good day.